It's Deb Wilkinson, and of course today we know it's the spookiest day ever, and that doesn't include 10/1 with this crazy rollout of Obamacare, the PPACA Law. Today we're going to talk a little bit about some of the updates on over-the-phone enrollment into the federally facilitated marketplace. We're also going to talk a little bit about the SHOP enrollment, how to get quotes for both individual and group, and then I do have a few questions that came in during registration. I'll go over those, and then of course we'll open it up for any of your questions. So we're going to get started, and the first thing we're going to do is talk about the updates on over-the-phone registration. This information is going to be in my newsletter that comes out today, again, but it was in the newsletter that was out or went out on Friday, the 25th. So please just keep looking at these Healthcare Reform Essentials newsletters, because I try to put in all of the pertinent information that you'll need to not only certify, get your certificates to the carriers, but also solutions, what I think are solutions to the tragedy and travesty of healthcare.gov. So first of all, the solution to marketplace computer glitches basically involves two different apps. One is for an individual app, and one is family. And what I am suggesting is that, I'm going to open one of these up. What I'm suggesting is that you give this information to your clients, and they can complete the application, because this is all the information that is going to be asked of them over the phone when they do their online enrollment. And you can see the short form. This is, again, for the individual. It's very important that you educate your consumers, if they are calling into the FFM directly, that they have to absolutely give your information to the person that is taking the application over the phone at the health insurance marketplace, or you will not get credit for the sale. I suggest that you pre-populate Appendix C, which is on the individual and the family app, with all of your information here on the application assistant authorized representative, as well as below in the agent information. The ID number would be your federally facilitated ID, and that ID is the username that you created when you went in to do your marketplace training modules at the Medicare.Marketplace Learning Network site. So that is the information that you would put in this blank here. Right here. Oops, didn't do it right. FFM number here. This is your national producer number, so you would fill that in. And I would recommend that you complete this on every application before you hand it out. You can certainly, let me see how I can get these highlighters off. Erase all drawings. There we go. I would suggest that you pre-populate all of this information before printing and handing out these applications. Once that is done, these applications are really, again, only used as a guide to what your client needs to tell the person at the other end of the health insurance hotline. There are two ways to do it. You can give them that number directly so they can call in, but again, you have to educate them that they have to, even if not asked, give your information, tell them to tell the health insurance marketplace that they're working with an agent, and give that information if not asked. Or I think a better route at this point is to schedule a phone conference with your client in order to do a three-way call, so that you can be listening in and you can volunteer that information if it's not asked. You know, I don't have a really good handle on how often it is being asked or how often it is not. I can tell you that different people at the other end of the health insurance marketplace are better informed than others, as in any business, of course. So again, it's very important that you get yourself established as the agent of record prior to any plan choices coming out. So I really do think that is a good solution. It's the only solution at this point, unfortunately, but I think it's a good one. So if we think of anything better, then I'll certainly let you know. The SHOP enrollment is a little bit more complicated because, as we know, the actual online SHOP enrollment and rates, full enrollment, is not going to be available until what they say is 12/1. Whether that comes to fruition or not is still in question, but at this point they're saying 12/1. In the meantime, the SHOP enrollment, and of course this is for groups under 50, the procedure for that is that an employer or a representative of the employer would have to go on to healthcare.gov and set up a marketplace account. They would then have to download the SHOP employer app and complete that and send it in. Once that information is received and processed, then the employer can go back in and log into the healthcare.gov and look at the plan choices and then proceed with the employee's choices. You know, again, this is all untried at this point, but this is at least the information I have at this point. Some of the other issues that we're having with the SSM, which are pretty interesting, is they are now, and keep in mind, I'm telling you this to commiserate with you because I'm going to be contacting the National Association of Health Underwriters as well as the Pennsylvania Insurance Department to let them know what is going on. But I had one of our agent partners get contacted by a person that had already gone on and did the online application. They received the determination of the subsidy, and what they're saying is that unless this particular person submits proof of their income by January 26th, that all bets are off, that they may not be eligible for the coverage. Now, that in and of itself may not seem like a whole lot, but I can tell you that it's really disturbing, since the proof that they need by January 26th is proof of 2014 income. So obviously it's illogical. So we're going to work, obviously, on bringing that to the attention of anyone that has half a brain that can realize that 2014 income is probably not going to be available at this point. Am I sounding bitter? Yes, probably. It amazes me, some of these glitches that come up. Obviously, nobody with half a brain actually sat down and realized how the process really should work. But I digress. Back to our agenda, quotes. A lot of you have been asking for information on how to get quotes, and pardon me. Obviously, this is very important. We are working on trying to make this a more user-friendly option for you. As always, your individual health case managers, either Jessica Kyer or Judy Reed, can be contacted, and they can supply individual health quotes for both on the exchange and off the exchange. So that's very important to remember. As far as group SHOP quotes, as well as group non-SHOP off the marketplace, again, you can contact Elise Wilkinson or John Reel, and they're happy to help you. We are working to upload all of the information that we have onto our site, and what I'm doing is showing you our site under the health plan options, under product information. You will see the individual health carriers as well as the group carriers. There are a few carriers that have paper rates, Blue Cross of Northeastern PA specifically, Highmark Blue Shield Central, Highmark Blue Shield Western. So there are some things on this site, from our site, that you can get. Again, Cap Blue Cross doesn't have paper rates. Aetna has paper rates, but rely heavily, please, on your case managers, because that's what we're here for. We're here to at least make this as painless as possible. One of the new things that we added to CAP Blue Cross, for those of you that are licensed and appreciate the Blue Cross product as it is, we did just add a new link that under both for private and public, the summary of benefits of coverage, if you go in, you can now actually view the complete SBC from our website. So again, we're trying to get all of this on our site as quickly as we get it, and as quickly as we can keep you informed. Additionally, we've heard had a lot of questions about Health Connect and quoting for the the marketplace for 1/1 effective dates. They're currently being loaded as well on our quoting tool. Right now, you can quote up to 12/31 for all carriers, obviously. The 1/1 carriers that have been added recently are Western Highmark and Blue Cross's Northeastern PA. We expect the other carriers to get on there as soon as the testing is done through Health Connect. So again, we're trying to make this as easy as possible. So that is our quotes and how to get them. Hopefully we can ease that pain for you. I do have a couple questions that were submitted, but before I get to that, I did want to talk a little bit about another webinar that's going to be held by our Life Department. Steve Clemens, who's the Vice President of Life Markets, is running a Life Cross-Selling 101 webinar on Tuesday, November 5th at 11:30 Eastern Standard Time. It's about a half an hour, but I think for all of you struggling and maybe being hesitant to tap into another market, that this might be a good opportunity for you to at least listen to the cross-selling PowerPoint and webinar, and if you find it helpful in your sales process and it increases your income, then no harm, no foul. So I think it's a good thing that you might want to partake in. The invitation is going out, obviously, but you can also go to our website and click on the registration key for that. Back to the questions that were submitted. There is a rumor, it's Leanne submitted a question. There is a rumor that applications are not accepting broker information for compensation. Is this being resolved? And absolutely, we're working directly with, again, NAHU and the Pennsylvania Insurance Department to get this resolved. Also, there is a screenshot from the healthcare.gov that we have saved, one of my agent partners saved, and it does look like there's an ability, at least an advertised ability, to add an agent after enrollment takes place, but at this point I'm not getting any information from the health insurance marketplace on how to do this. I'm going to work, obviously, to see if this can be resolved. But it is an issue that everyone is aware of at the state level as well as the National Association level, and we're working on getting that resolved. Lynn asks, as a broker, I need the rates and the plans available on the exchange without having to enroll each client first. Absolutely. I couldn't agree more. And the way around that, again, is our website, or to rely on your case manager, because they have everything in PDF that is available out there in the marketplace, and they are definitely willing and able to help you get that. Ken asks, he says he's certified. Now what can he do to get a quote? The website is always unavailable. Are there going to be commissions paid under this new law, or is it a do-it-yourself only deal? That's several questions all in one, but hopefully I already covered how to get a quote. Contact your case managers, either group or individual. The website is always unavailable, absolutely, and on the healthcare.gov you can now view some rates, but they're not specific rates for age. It's either under 49 or over 50. So they're still not even accurate. So, again, rely on your case manager for those rates. And what you almost have to do to get a semi-accurate rate is to obviously get the rates from your case manager or from the carrier's websites or our website, and then you have to join that up with a Kaiser Family Foundation subsidy estimator, because that's going to determine whether you make application, help your client make application via the federally facilitated marketplace over the phone, or whether you just have them apply outside the market. Whether you are writing inside the federally facilitated marketplace or outside, as business as usual, there are commissions, and they are the same in as out, and yes, you will get commission. Just want to touch on real briefly, again, for any off-exchange application, it really is business as usual. You can get your quotes the same way you have at this point from your case manager. You fill out a carrier-specific application, you submit it to us, and we process that, sending it directly to the carrier or creating an online submission from that paper app. So for off-exchange apps, it's business as usual. And another question from Chet, when may we sell through the marketplace? When may we sell through the Blue Cross? When can we sell Blue Shield? How do we find out if we are properly licensed to sell through the marketplace? The marketplace technically opened 10/1, obviously to a lot of glitches. We have the workaround now. Blue Cross and Blue Shield, all of the Blues are on there. Capital, all of them are on there. And the way you find out if you're properly licensed to sell through the marketplace is relatively easy. If you've done your marketplace curriculums for individual and shop, if you've grabbed those certificates of completion and either sent them via email or fax or uploaded them through the carrier-specific website, then you are licensed and appointed to sell the plans through the marketplace. So I hope that was helpful. We're going to open it up now for questions, and I don't have any hands raised, but if you do have a question that you want to share with the crowd, then go ahead and raise your hand. At this point, I'll just go through the questions that were submitted. And actually, there are quite a few. And the first question comes from Bill. Can you get subsidies at any metal level? And the answer to that is yes, except the advanced tax credit. The answer is yes. And I also want to clarify on the catastrophic, if a subsidy is available on the catastrophic, and I'll get back to you. I'll add that in as a follow-up. But for the advanced tax credit premium subsidy, available at any level, and it's based on the second lowest cost silver level plan in your state. And the cost-sharing subsidies, where it actually reduces your out-of-pocket, that you have to choose at least a silver level plan. Bronze is not available. Rich says, happy Halloween, so right back at you. Abby asks a question on the on-exchange only application where it asks for the ID number. My MLN ID is actually all letters and not numbers. Will that be an issue? Not an issue at all. It's a misnomer that they're putting the number in there, but it's really just your login, whether it's all numbers, all letters, all caps, whatever. That is the number that you put in there, and that was the user ID that you created for your Marketplace Learning Network site. Cindy is asking, any updates on timing for verifying identity? She said that she's entered an app 2.5 weeks ago, uploaded documents to prove identity, and still no decision. She accessed the app on Monday, and the identity verification pending message was gone, and they were waiting for documents to upload. She uploaded them again, and as of today, no follow-up from healthcare.gov. Cindy, you know what? I'm not sure what the answer is to that, but I'd love to talk to you and get more details because I certainly want to bring that to someone's attention. So I will call you after the webinar, and we can go through that. And, of course, I'll share the results in a future webinar with everyone. Tim asks, if a prospect is covered under a group plan and leaves the employer, and this happens after March 31st, can they apply via FFM for an on-market plan with effective date after March 31st? And the answer to that is yes, because that would be a qualifying event if they are losing group coverage. So the answer is yes. And Jamie asks, he says, Deb, you mentioned that our reps can provide rates for both on and off marketplace. Aren't the plans and rates the same? I understood that the only difference was the ability to qualify for tax credits. Jamie, that's absolutely true, except for Capital Blue Cross. They have different plans on than off. So for most of the carriers, same plans on and off. And also, if your client is eligible for the cost-sharing subsidy, the plans actually change. So the SBC's summary of benefits of coverage are actually different for on exchange for those under 250% of the federal poverty level. So that's why I make a point to say they can provide for on and off, because there's a lot of moving parts. And Bill asks, will Geisinger be paying agents? I don't know that yet. I don't know if Geisinger's paying agents. I don't know if Blue Cross of Northeastern PA is paying agents. I do know that, and trust me, I keep asking, but Blue Cross of Northeastern PA, I believe, has definitively decided that they are going to work with agents, but the compensation amount is still unknown. So again, we're following up with them. We're trying to get the information as fast as they'll release it. Chris asks, are medically underwritten individual plans still available from all carriers through the end of the year? And absolutely, Chris. If you have, and again, this is a huge opportunity, if you have a client that you know can get through medical underwriting, then please, by all means, try to secure coverage for them prior to 12/31 of 13, because 9 chances out of 10 it's going to be less expensive for them, and also it's going to carry them through the better part, if not all, of 2014. So absolutely, look at your client database, look for early rewrites if possible, look for when clients do call in up to the end of the year, if they are medically underwritten or able to be medically underwritten, and it's a huge opportunity. Margie asks where she sends her certificates for the exchange for Cap Blue Cross, and there is an email. It was in the several past healthcare reform essentials newsletters. So I'll email it to you, Margie, but for everybody else that is asking about where they send their certificates of completion, I would check the last few editions of the HCR Essentials, because it's all in there for each carrier. And does Capital have plans with pediatric dental already embedded? Yes, they do. Sean asks if I can recap on paper application. Should we as agents fill out both sections of the appendix? Absolutely, Sean, because I don't want any mistakes to be made. So the top section has your information, such as your address, rather than just your organization and your numbers to identify you. So at this point, I'd stamp myself all over those apps and fill out all of Appendix C. Bill asks, how do we handle apps for people who will be eligible for Medicaid? Well, that's a really good question, Bill. Medicaid is still not open to agents to sell. According to all of our training through the modules, the applications that you're using for the marketplace, either individual or family, are eligible or able to be used for your Medicaid recipients. I just wouldn't recommend it. I would say that if your clients are eligible for Medicaid, then I would look up that number for the Department of Public Welfare or refer them to the COMPASS website, COMPASS.com website, and have them get in touch directly with the people that can help them either make application for Medicaid and send them an application or help them online. Kim asks, hey Deb, are we entering apps on healthcare.gov or cms.gov? It is the website is healthcare.gov, but I would not recommend using that site. There are known issues, as we've all heard in the news lately, and I don't trust the system. They say the system is not going to be fully functioning until the end of October. The end of November, and I'm not sure that it's even going to be up and running by then. So the only surefire way to get this done is to use the over-the-phone process. And John asks, must warn people who forecast incomes of just above 138% then get $0 premiums, but then actually end up paying up in the 100% to 138% whole, that they'll end up paying 100% of premiums at tax time in 2015. Yeah, John, I understand what you're saying. There's still a lot of issues in Pennsylvania with Medicaid expansion, but the 100%, the way the subsidy estimator works, if you're below 138, it actually shows that you have zero subsidy available, and it talks about if your state expands Medicaid. But the way the law was written, it did allow for 100 to 138% to actually qualify for a premium subsidy. It's just that there's no way to relay that. Again, this is something that they're going to have to resolve at some point. And let's see. Margie asks, sorry if she missed this, but does Capital have paper rates apps for 2014 plans? They have apps, of course, for 2014. They have SBCs, but it's my understanding that they are not going to even work on paper rates. We did have like a quoting little tool that came up, or that was given to us by Capital, and we're hoping that they'll allow us to release it, but it's easier than getting on the website. We just are not able to release it. So your case managers at this point can get you those easy rates as opposed to you logging into the website to get them. But I don't believe that paper rates are going to even be looked at. And Kim asks the question what cms.gov is going to be used for, and that's more of an information hub. And Jamie says that the correct COMPASS website, thank you very much, is COMPASS, COMPASS.state.pa.us. Thank you very much, Jamie. I appreciate that. And was cms.gov just to register our NPN so that we could sell? And I think you're talking about the portal.cms.gov site, and yes, that's my understanding. The cms.gov site is an information hub where you can get apps, etc. The portal.cms.gov site, at least at this point, my understanding is there's nothing we can do other than register on that site so that you can sell on healthcare.gov. And Chris asks, he says he noticed on the subsidy estimator that many people below 400% still are not eligible for tax subsidies. What causes this? Is it because it's based on a silver plan? I would have to look at that specifically, Chris, and if you want to give me a call or shoot me an email, I'll look at the situation and see what happened. But everyone up to 400% of the federal poverty level is eligible for some sort of advanced premium tax credit. So I'm not sure what you're seeing, but I'm interested to find out. And it looks like that is the last of the submitted questions. If anybody else has any, please type them in quickly, or if you want to raise your hand, go ahead and do so. And I did want to let you know that our next webinar is going to be 2 weeks from today. It's Thursday, November 14th at 9:30 because I'm actually out of town next Thursday. So unfortunately, I won't be holding a webinar then, but look forward to hearing from all of you, and hopefully you can join in the following Thursday, November 14th. So thank you again for your participation in these weekly events. Keep your questions coming. The better informed we all are, the easier all of our jobs will be, and we can get back to the business of selling as opposed to figuring out websites and workarounds. So happy Halloween, everybody, and enjoy your day. Bye-bye.